here with us, and we're going to be doing the COVID update. We're live on Facebook right now, and I'm welcoming the good lady. I'll be sharing this on the HRB Breakfast page and on the Sunday Best page. But you can also find it on my page, Opoku Pari, and on Dr. Seshni's page. Dr. It's just Seshni Moodley out there. All right, guys. Welcome to the COVID update, and good morning, Dr. Seshni, and welcome to the COVID update. How are you today?
I'm good, thank you. Good morning, Opoku, and hope you're well. How are you today?
I'm very well, thank you. A bit tired, though. Well,
I can imagine after all that celebrations for your daughter's birthday. I'm sure.
I'm tired, but I cannot really say that I'm tired because my wife is absolutely shattered. She did all the hard work. I did some cooking and all that, but yeah, she stayed up to clean up and do this and that. I was just snoring away. So I feel sorry for the lady, but hey.
Oh, well, I'm glad you had a wonderful celebration, and
Yeah,
I trust Amy had a wonderful birthday.
Yeah. We had a good time, and once again, I'd like to say thank you to you and your family and every single person who sent in, the well wishes and gifts and all that. So yeah,
It looks like it was a lot of fun.
it was. I'm just looking at this woman, and I'm thinking, oh my God, just like feels like this yesterday.
I know.
Anyway, such is life, isn't it?
I know. Your babies just get grown. They grow up, and
I know.
that is life. And now she's an adult, 18.
Yeah, she's old enough to become prime minister. Yeah.
I know. She's ready for the world.
Yeah, I know. Anyway, the first thing that popped up this morning for me when it comes to the COVID situation was, was it last week or a couple of weeks ago? We got a question from Jeff White asking about the Moderna vaccine. So
yes.
Where's it going? Because we haven't talked about it for ages. And then it pops up this morning. The third COVID-19 vaccine will be rolled out across Wales on Wednesday.
Yes.
From Wednesday, that's from today. And it's the Moderna vaccine.
Yes. So that's a new news, actually. There's a lot of news today. But COVID-19, another key milestone as Moderna vaccine rollout begins in the UK. So the UK has bought about 17 million doses of this jab, and the results show that it is 100% efficacy against severe cases. So it seems to be quite effective, and obviously seems to be one of the vaccines, or the third vaccine, as you said. The first one, we had the Pfizer, then the AstraZeneca, and now we've got the Moderna, and hopefully the others will roll out as well, which is the Johnson and Johnson and any other ones that we might be getting. So they said the first dose of the jab are going to be administered in West Wales, in Carmarthen.
Oh, it's the same. It's really the same system with the others. Two doses. Okay, one, and then a few weeks after you get a second dose.
Yes. Yes. As far as I know, it was 2 doses, so it's the same.
Yeah, it is 2 doses. Yeah, that's what it says. Yeah.
So they said they will leave at least 2/3 will receive at least 1 dose. And of this, and so Department of Health is obviously issued agreement, and there doesn't seem to be any concerns. There's no serious concerns identified with the Moderna, and some events like pain after getting the vaccine at the site of the injection has been reported. But that's a normal, effect.
That's to be expected, really, isn't it?
Yeah, fatigue, muscle pain, joint pain, and headaches after receiving the second dose. So it's not really serious effects or side effects. There's just the other news about vaccine is obviously the AstraZeneca, the trials in children have stopped.
I just got it popped up. I was going to actually bring it up and ask you about it. You talked about there's no real concern with the Moderna, but the concern here is with AstraZeneca, as you just pointed out, because they're saying that the trial of that AstraZeneca COVID vaccine on children has stopped. They stopped giving out jabs while the UK's medicines regulator investigates a possible link with rare blood clots in adults. This blood clot thing has always been a concern. It was raised especially in the European countries and in was it in Thailand as well?
Yeah.
And then it was sort of rubbish. Maybe rubbish is too strong a word, but it was like no, there's nothing like that and all that. But it keeps coming up, and now in the UK,
yeah,
talking about
So that's quite serious, isn't it? When I read this yesterday, it was quite serious to know that the rollout of the trial of the Oxford AstraZeneca COVID vaccine has stopped giving out jabs while the UK medicines regulator investigates a possible link with rare blood clots in adults. So they stopped giving this to children. So there seems to be a lot of people that obviously are concerned about the AstraZeneca. So I think it's quite timely then that, with these concerns on the horizon, that we now have the opportunity to have the Moderna vaccine, because obviously a lot of people are concerned about the Oxford AstraZeneca.
All right, okay. There's another story which I think is properly up your street that we can talk about. Where is that? There we go. It's saying, let me just read it to you. It says people diagnosed with COVID-19 in the previous 6 months were more likely to develop depression, dementia, psychosis, and stroke. Researchers have found.
Yeah.
And they say that a third of those with a previous COVID infection went on to develop or have a relapse of a psychological, neurological condition. And they're talking about, stuff like brain hemorrhage, stroke, Parkinson's. How do you pronounce this? Is it Guillain-Barré syndrome?
Yes, Guillain-Barré.
Okay, that's very French, isn't it? So I just wanted to be sure that it's right. And the dementia, psychosis, mood disorders, and anxiety disorders. What can you tell us about this? This is up your street, really.
Yes, it's interesting and very true, obviously, that COVID-19 does raise the risk of depression, dementia, and all these other mental health conditions. So, and other neurological conditions, brain hemorrhage, stroke, Parkinson's, Guillain-Barré syndrome, psychosis, mood disorders, anxiety disorders. So we know that, when we first started talking about COVID-19, it was about the psychological impact. And a year on, we are still talking about it because that's how important it is. So it seems to be that the anxiety and mood disorders were the most common diagnosis amongst those with COVID-19, and more due to the stress of being ill or taken to hospital. So these conditions, it also include other conditions like grief, so depression and grief as well. Also, I would say coronaphobia or chronophobia, the fear of coronaphobia. I would also say that there's a lot more other conditions, also including PTSD, which can fall under all these mental health conditions, in addition to what the study found. So it seems that they're saying that that people who've had would have had a stroke or depression in the 6 months of COVID-19. So that's quite concerning and quite worrying as well, because it seems that they're saying 16% of people were more likely to develop a psychological or neurological disorder after COVID, other than respiratory infections, and 44% more likely than people recovering from flu. So it's quite significant. Mood, anxiety, psychotic affect 24% of people but rose to 25 for those that were admitted into hospital, and 28% that were intensive care, and 36 those who experienced delirium while ill. Stroke affected 2% of all COVID patients, rising to 7% those admitted to ICU, and 9% who had delirium.
Mm.
So
I'm just reading this paragraph here, and it's saying that conditions like stroke and dementia were more likely to be down to the biological impacts of the virus itself. That is scary, man. Or of the body's reaction to infection in general. And COVID-19 was not associated, they're saying, with an increased risk of Parkinson's or Guillain-Barré syndrome, a risk from flu. My concern really is the stroke bit, stroke and dementia bit, whether it's more likely to be down to the biological impacts of the virus itself. That virus is wicked, isn't it?
Yes.
It causes a lot of damage.
Yes, so that's what they're saying. It can have, and rightly so concerning as you raise, it can have other indirect effects, for example, affecting the blood clotting, which can lead to strokes, and the general inflammation which happens in the body as it responds to the infection can affect the brain. So this is how you would get conditions like strokes and other concerns. So yes, it is still a concern that, if you do get COVID-19, there are long-term effects, the long COVID. There's an impact on psychological effects and the physical health effects. So the study confirms that the suspicion that COVID-19 diagnosis is not just related to respiratory symptoms, it's also related to psychiatric and neurological problems. So the after effects can appear much later than expected, something that is no surprise to those suffering from long COVID. So I think it is something to be aware of. And I think more and more, what we suspected is that mental health is becoming more and more of a concern, because it's not just dealing, the mind and body is linked. This is what I always explain, and that's what I've written in my book when I teach other psychiatrists worldwide, is that the body and mind is linked. So whatever affects the mind affects the body, and whatever affects the body affects the mind, and vice versa. So it means that if someone gets a physical health condition, it is possible that that will also affect not just their physical health, but their mental health. So I think this is what it's important to understand. It's not that you get a physical illness, you get treated, and then it's over. It's obviously has some lasting effects on people's mental health. And that's why it's so important that if people are experiencing any mental health conditions or, consequences as a result of the COVID-19 or anything directly or indirectly, they do need to seek help. Because, and this is not even talking about the social impact of COVID-19, the stress, the acute stress reaction, other huge risks like comorbidity of using substances and drugs, domestic violence, and also financial strain and increase in poverty. So there's so many other indirect effects that COVID-19 is having, which can also impact on mental health.
Well, I don't want to say devastated, but thinking about the effect, because for some of us who are not medical and we're just laymen, we think, oh, you get COVID and you're cured, or you come out of it, and end of story. But from research and from what the scientists and yourself, who's also a scientist, are telling us, it's not the end at all. I mean, so many other things that follow: mental, social, and all that. Yeah. Well, that also goes to warn us to be really careful. I mean, we should do everything we can not to get infected with COVID-19.
Yes, that's true. And I think it's really important. We're only seeing the tip of the iceberg now. I think 2020 obviously was when we were in the midst of the pandemic, 2021, we're starting to see that things are improving. But however, what we're realizing is that we're still going to have to recover from the effects of what has happened from 2020, because you must know we've had about 3 lockdowns. We've had millions of people die globally and get infected with COVID-19. So it's not something that we're just going to recover, just by. And that's the thing with mental health, what I try to explain to people. When you cut yourself or you hurt yourself, you can put a plaster or band-aid and it can heal. But with mental health, when you get affected with mental health, when something happens, when you become so stressed or overwhelmed, or you even attempt to harm yourself or end your life, or feel quite hopeless and helpless, or in a very dark place, as some people describe it, in depression, then it's not that easy. You can't just put a band-aid and it's going to get better. It takes time. So I think we all need to just be more kind to each other, listen, offer help, or lend, or offer help or get help for those that need it. And
Yeah,
also,
help is that professional help, and if there is, I'm sure there is professional help
yes,
of people like you and others.
yes. So
Who
yeah.
give professional help. How do we get this help?
So yes, it is important. So mental health is important. Mind is one of the charity organizations which obviously offer help, and it's free to contact them. The website is www.mind.org.uk. And they're saying
Mind,
that
as in M-I-N-D.
MIND, and they said that actually the headlines on their website is, "This is a mental health emergency. The coronavirus pandemic is having a huge impact on our mental health. Help us be there for everyone who needs us at this crucial time." So they people know that it is a concern at this moment in time. So you can contact them on their website, as I said, or you can call them on the info line, which is 0300 123 3393. So 0300 123 3393. And there's Childline for children, which is also helpful, because obviously we know that there's a lot of children that you can imagine going through online schooling, not seeing their friends, being in lockdown. Imagine the impact of them, of the mental health on them as well. So Childline is so these are all UK numbers. So wherever you are in the world, do look at your local mental health services. But in the UK, Childline is 0800 1111. So 0800 1111. And everything is confidential. So parents and children can also contact Childline. For mental health specifically, if there's any concerns, people can go and see their. I think the first and foremost is identifying that there is an issue and getting help. If you are not in the position to get help, hopefully a friend or confidant, someone you can trust or you can confide in, they can offer you the help or get you that help and motivate you to get that help. Because a lot of the times there's a lot of stigma, but we need to raise awareness. We need to say it's okay not to be okay, because this is real. Mental health is important, and if you need to get the help is there and available for you. So you need to make that step. Secondly is obviously contact your GP or healthcare professionals, your mental health professionals. Third is every service in the UK, every suburb or area will have a mental health team. So you can contact the community mental health team, the crisis teams, or the local services that would have a 24-hour service for crisis. So any person that's going through any mental health issues can contact the crisis team. Obviously, there's specific conditions like addictions, personality disorders, early onset psychosis. So there's different branches, eating disorders, old age mental health, older persons mental health services, and the CAMS for children. So they can contact each of these separately, or the general mental health service. And then fourthly, There's help in the form of medication, psychological treatments, and social interventions. So it's always a holistic approach. So looking at medication, if you think you need to go on an antidepressant or something to calm you down, something to help with anxiety, psychological treatments like CBT or cognitive behavioral therapy, or any other forms of counseling or talking therapies, and social interventions like groups, online groups. We're fortunate now with technology, we are able to have all these access online. So there is enough information. If people want also more information and leaflets, they can check the Royal College of Psychiatrists, which has a lot of information. So it's www.rcpsych.ac.uk.
Oh, that's fantastic. Thank you very much for this amazing information. Right, okay, we're 10 more minutes to go, so that's just that we do the numbers. What was it like in the last 24 hours in the UK, even before you I'm kind of curious.
Yes, so actually the headlines actually didn't have it on today, because I think it's still quite low. It's a little higher than yesterday, I would say, but it's still very low. So in terms of the last 24 hours, so we've had 20 new deaths in the last 24 hours with 2,379 new cases.
Wow.
So every life matters, but the numbers are going down slowly.
Yeah, the numbers are going down. So yeah.
So hopefully soon, zero cases, zero. Yeah. So it's.
You come on and you come on the show and I say, what's it like in the last 24 hours? I say 0.
Yes.
Great. Oh, that would be the day.
I know, but I do think that and this is quite amazing after that the numbers are still quite low, especially after Easter weekend. But I think what's important now is this is going to be the crucial time. I think people should not let their guard down. None of us should. We need to continue doing what we are doing and aim to eradicate the coronavirus, and do whatever it takes, hand sanitizing, washing your hand for 20 seconds, maintaining social distancing, staying at home, and staying alive and protecting the NHS, or just wearing a mask or face coverings, and just using whatever measures that the World Health Organization, who Dr. Tedros and his team have told us to do, because it's working and we are seeing the benefits. 12th April will be a good test when a lot of businesses are going to open.
It will be. Yeah.
But I think that even if the businesses, we can talk about that tomorrow, but I think even if businesses are going to open, I think people are still going to be very cautious. And especially now they're talking about the COVID pass or COVID certification system, and the COVID immunity passport, which could be digital and non-digital. So I think even though we might have all of these that will be around, it's going to be a case that obviously we're going to see that people are going to be very cautious. So I wouldn't be letting my guard down anytime soon. And I'm sure a lot of people we're so used to it now. It's like, if you need to celebrate a birthday, we'll do it indoors. It's fine. You can order a takeout and carry out. You can enjoy yourself like what you did yesterday. So it's just people are just, and even like groups of 6, people are keeping to groups of 6, or maybe 2 households meeting up together, and businesses are going to be very, very careful as well, because they wouldn't want their own staff and their businesses and premises, getting infected with COVID-19, because then it has to be sanitized and disinfected, and staff will have to be isolated for 2 weeks. So I think everyone is going to take it very, very, very cautious and be very careful, which is really good. And I think it's reassuring to know that.
Yeah. Okay, so let's do the numbers now, and then we'll move on.
Yeah, so the numbers. So in terms of the last 24 hours, today, the 7th of April, 2021, we have 133,050,039 positive cases globally. Deaths are 2,886,728, and total recovered is 107,300,824. So quite a
Yeah,
lot
that's
have.
because I'm yawning. It's human nature, man. I'm only human. I'm tired.
But just think about the amount of times you can go back and see how many times I've yawned on the show. So you hardly
I
ever
wish I could go
yawn.
back to sleep after this show, but I can't. Got too much to do.
I know
Anyway,
you hardly ever do it. So I'm just, it's quite funny. Yeah, so USA number one with 31,560,438 positive cases with 570,260 deaths.
mm-hmm.
Two is number Brazil with 13,106,058 positive cases with 337,364 deaths. India number three with 12,801,785 positive cases with 166,208. And India showing a additional or number of 2,039 new cases. So seems to be increasing. France number four with 4,841,308 positive cases with 97,273 deaths. And Russia, 4,597,868 positive cases with 101,106 deaths. UK number six with 4,364,529 positive cases with 126,882 deaths. So yes, UK still doing quite well.
Quite well. Before you go to South Africa,
Yeah.
I'm kind of worried about Colombia. It's a very small population, small country, but they are number 11 on the list, and Colombia's got 2,468,236 infections with 64,524 deaths. That's quite worrying for a country that's as small as Colombia. What do you
Yes.
think?
Yes, it is. So that is quite concerning, actually. The numbers are obviously quite high for a small country. And something else that's popped up is obviously Mexico number 14 is still increasing with an
Yes,
additional.
I was just about to say that. Yeah,
Yeah.
read my mind.
Yeah, 4,675 positive cases in the last 24 hours. And Ukraine, which is number 16, is 15,415 positive cases. And Pakistan, 4,004 new cases.
Where is Pakistan on this thing? On
So
the list? No.
Pakistan is number 31, but the number of cases are increasing quite rapidly.
Yeah,
So I think it seems there's a third wave on the horizon, I would say. So I think that's why this is so much more that we need to be cautious. We need to not let our guard down.
yeah.
So in terms of South Africa, unless you want to say anything else, South Africa number 19th in the world, 1,550 2,853 positive cases with 53,032 deaths. And so they've done quite well. And Ghana is number 91 with 90,946 positive cases with 752. And as we read earlier, UK has done really well with 20 new deaths. Obviously, every life matters, but the figures definitely, if that's accurate figures, it's 20 new cases, 20 deaths in the last 24 hours. And the total number of cases, 2,379, which obviously, since we've started the pandemic and in the last few weeks, it's like almost the lowest, because we used to see up to 1,800 deaths a day, and yeah, and up to quite 10 to 20,000 positive cases in 24 hours. So the numbers have gone down significantly. So it's really fantastic news, and hopefully we'll continue with the same. Before we log off, I don't know if there's anything else. There was just the community immunity passports, which obviously were the other news, but just to say a happy birthday and shout out to Navina. You might have met her at Shreya's birthday and from Birmingham, and it's her birthday today. So hope she has a wonderful day and lots of love and light and blessings from myself, Vadi, Shreya, Aryan, and Sitara. So Navina Bhagwadeen, she's in Birmingham.
birthday, Nazina. I think I did because I met a whole group of your relatives from Birmingham, and lovely people they were or are. So, Navina, if you're listening to us, and I'm sure you probably listen to us.
Yeah, and her husband Anush usually listens, so maybe one of them is listening.
I met Anush.
Oh yes, you did. So Anush's wife, yes.
Yeah, I did.
Yes, yes.
Ooh, okay. So happy birthday, Navina, and have a fantastic day. Enjoy your day. Enjoy your day, and thank you very much, Dr. Seshnamula, for joining us.
You're welcome. There's probably still a lot more to talk about, but yeah, time's up. It's amazing. Time's just gone ahead of us. But yeah, we'll probably talk tomorrow more about the vaccine, more about what's happening in the rest of the world, and about the immunity passports.
What I'm gonna do, what we should do tomorrow is when as soon as we come on, let's something that's breaking news and that we really need to delve into. But when we come out tomorrow, you just tell me what you've got, and then you just go ahead with it so that we can cover everything really.
Brilliant. We'll do that. That's the plan tomorrow. Have a fantastic day. Lots of love to everyone from us. Let's spread the love. Sorry?
Unfortunately, I can't.
Oh no. Hopefully you have some rest later on. But yeah, let's spread the love and not the virus, and stay safe, everyone. Bye. Thank you. Thank you. Bye. Thanks everyone for joining. So there was a Hospital Radio Bedford with Apoko Pari. Lots of love from my family to yours, and namaste, guys.